American history. We're getting new data. We'll bring it to you live when it comes in.
Okay, we want to bring in Dr. Ashish Jha. He's the director of the Harvard Global Health Institute and CNN chief political correspondent Dana Bash. Great to see both of you. Dr. Jha, there's just a macabre way that Dr. Khan, who we interviewed earlier in the program, described the national strategy that we seem to be engaged in. He called that the 1,000 deaths a day strategy. That somehow that's where we are. That is what we seem to be accepting. I mean, John and I have talked about this so often. The numbers are so astronomical. Sometimes it's hard to get your head and heart around 150,000 Americans more. And every day we're setting these new death records. What do you see in the strategy here?
So good morning, and thank you for having me on. It is incredibly sad. It is incredibly frustrating. At times it makes me outraged because 1,000 people a day, we say, well, it's just another day, another 1,000 people. That's 1,000 families that are grieving, that will not see their loved ones again. And the idea that we've just come to accept it because we have no real federal leadership and often in many states, very poor state leadership. This should not be acceptable for the wealthiest nation in the world. We have more than enough capability to bring this under control, to save most of those lives. And we're just choosing not to do it. And I have to tell you, most days, it just baffles me. I don't understand how we are where we are.
And to be clear, that number 1,400, it's back where it was at the beginning of May. We blew it. We blew this response. We were headed in the right direction, and now we have turned in the wrong direction. And Dana Bash, I don't know if we have the pictures from Texas of the president when he was signing whatever he was signing, surrounded by people standing shoulder to shoulder, unmasked. That picture is stunning, given where we are right now. Texas just regularly records new highs in daily deaths. They didn't yesterday, but the hospitalizations there are still staggering. The death count still incredibly high. And everyone there is standing and smiling within feet of each other. And on top of it, it is worth noting, and this is something that they note every night on Anderson Cooper show, the president doesn't talk about the death count. He doesn't talk about the human toll and the toll on families.
No, absolutely. I mean, that would make, there are lots of reasons. One is the empathy factor. Two is that would make it real. And three, it's bad politics. Those are all, the top three reasons. There are others as well. Those pictures, that video of Texas is so alarming on both just a human level, a leadership level, never mind, a raw politics level. On the leadership, what happened to the guy who tweeted out a couple of weeks ago a picture of him in a mask saying it's patriotic? Well, there he is in the Lone Star State, not being patriotic. And because he's not wearing a mask, it gives license to all those people who were there gathered around to also not wear masks in a state that is really, really reeling from the coronavirus and has seen spikes because of the fact that these social distancing, mask wearing policies were not in effect early enough. It makes absolutely no sense at all, except for the fact that he clearly felt like he was backed into a corner. That's why he said to wear a mask a couple of weeks ago. And he obviously doesn't really mean it, because if he did, he would have been wearing one yesterday and every single time he is in public since then. And for the most part, unless he's in a hospital, he is not.
Dr. Jha, Congressman Louis Gohmert was supposed to be with the president in Texas on that trip, but he couldn't go because he tested positive for coronavirus, as we've said. He is thankfully asymptomatic as far as we know at the moment, but he's also a case study. He's like exhibit A in terms of how not to wear a face covering. So for a long time, he flouted the idea of wearing one. And then when he reluctantly did wear one to a hearing, we have the video. He is manhandling his mask relentlessly. He's tugging on it. He's itching it. At one point, he blows his nose into it. His nose is very itchy. He pulls it up over his eyes. We already know that a bandana is the least effective face covering. And he just was not modeling the right behavior there.
Yeah, when I look at where we are as a country, 150,000 deaths, when I think about the fact that majority of kids in America will not be going back to school this fall, And then I realized that the main reason is because our political leaders refuse to do the simplest and easiest things, like wear masks properly. My 8-year-old wears a mask all the time when he's outside the house. He knows how to do it properly. I'm confident the Congress can figure out how to do it properly. When our kids are not going to be able to go back and people aren't going to be able to go back to work because of this kind of behavior, it's a little bit shocking. Like, I can't believe this is where we are, that people refuse to be adults and do the basic things that's going to get us through this pandemic.
Yeah, look, I will also note that Louis Gohmert preaches from a political side that occasionally talks about self-restraint. Didn't really exhibit any there, self-control, touching the face. Dr. Jha, you have written over the last 24 hours calling for basically the country to rethink testing completely. What do you want to see happen?
Yeah, so look, we've had a strategy of these PCR tests. We're obviously running to the end of the road now. About a dozen states are seeing drops in testing. It's just not working. We need a new strategy, but that new strategy actually need not repeat some of the same mistakes. What I have argued for is we need ubiquitous testing. Even if those tests are not as accurate, the bottom line is if we had cheap available tests where you get results back in 15 minutes and we could get people to test on an ongoing basis 2-3 times a week, we would drive the level of infection down to very, very low levels. So we have to rethink testing here. We want cheap, ubiquitous testing, even if the accuracy isn't so high. That's not the most important part. What we really need is tests to be available and give us results very quickly.
Dana, I just want to ask you about John Lewis's last words to us, which we just got today. I mean, it's so powerful that so many days after his death, he had planned this piece in the New York Times for the day that he was buried. So he wrote it, they held it, and we get to hear from him again, which is, such a gift, obviously, after somebody dies, to be able to hear from them again. And so you spent so much time with him. Tell us your thoughts on his final words here.
Wow. When you read it, I was thinking, I'm glad it's Alisyn and not me, because I was feeling how you were, just so totally overwhelmed with emotion, because he was so careful and, crafty, basically, in how he wanted his last words to be heard. And the whole message was the message of his life, which is get up, do something, don't just sit around, but also to pass the baton to the next generation. And what also strikes me, Alisyn, is that when I had the privilege of attending one of his annual civil rights pilgrimages, this was 2 years ago, I was in Selma, Alabama. It was while the congressman was at the church service, before he walked across the bridge. Me and my colleagues, Jeremy Moorhead and Bridget Nolan, noticed a 10-year-old boy holding a sign thanking John Lewis. Long story short, we were able to get him over to the back entrance. You see him there. He met John Lewis. The two of them embraced, walked across the bridge, stayed in touch. This young boy is now 12. His name is Tybre Faw. He went back twice with John Lewis, went to see him in the Capitol, decided he wanted to be a congressman as well. And guess what, guys? That young boy is going to read a poem at John Lewis's funeral this morning. That is the kind of man that John Lewis was, sending a message to not just Tybre Faw, but all of the young people that if you have it in your heart to try to change the world, I want to help you, just the way John Lewis was touched that way by Martin Luther King Jr. He was a teenager, wrote King a letter saying, I want to help, and King sent him a round-trip bus ticket. And that's the way John Lewis started. That's what he wanted to do for this young man and so many others.
Thanks a lot, Dana. How much mascara do you think I have here in my studio? Oh gosh, it's all so powerful, and it is. I encourage everybody to read this piece that he
it's
planted basically in the New York Times today. Thank you very much,
Look,
Dana.
That sign that Tybre was holding, thank you, John Lewis. The entire country and the world, frankly, holding the same sign, I think, this morning. Also, we did learn one thing in that, John Lewis, when he visited the Black Lives Matter Plaza and took that iconic picture, he was hospitalized the very next day. Mm-hmm. It's something he wanted to do no matter what. Stirring. All right, Dana, Dr. Jha, thank you very much.
Thank you.